every morning with truth in our hands. No more silence, we take the stand. For the people who cry, for the dreams that fade. We speak for the hearts that justice betrayed. Radio Trubida
on FM 103.9.
Radio Trubida
on FM 103.9.
Now we voice, now we power. True video go shine like tower. We no go fear, we go talk. Even if they know how make we talk. True Mega Radio on FM 103.9.
Now glory they Friday, not true they preach. Freedom of speech, not that we they teach.
For Salon, we go stand tall. Radio True video,
one voice for all.
We honor the land, the struggle, the fight. We shine a light in the darkest night. Because we believe in hard work and faith to Sierra Leone way. We hold the line, come what may.
Them won't set we more them, but we go shout. Now the poor man voice we they bring out.
Now we are right for know the truth. Now that make we go protect the truth.
Truth began more than it get anyone.
We are the voice, we are the flame. Truth will rise, don't know our name. We are the truth and nothing else.
Truth they get, we know they play.
Now for Salon, we declare the way. Tune in every day to
Truth me get radio.
3.9.
Truth me get radio.
3.9. Radio to media. Radio to media. Radio to media. Radio to media. Radio to media.
On FM 103.9.
Radio to media.
On FM 103.9.
Travel smart, dey safe. Salon dey welcome you.
You dey plan for travel from Salon? Before you fly, no forget say Leone Health Travel Portal na by force for all who that dey enter or left the country. This na thing wey dem put in place for top Salon for record Ebola case dem wey dey among other country dem.
Correct. Everybody wey dey travel, big person or pikin, for register and complete the health declaration form inside 72 hours before you travel.
And this na the important part. If you no fill the form, dem no go allow you for enter or left Salon. This dey make sure say you comply with the Ministry of Health and the National Public Health Agency, the regulation dem.
This go protect your body one, give more strength to public safety and keep we aligned with the Ministry of Health and the National Public Health Agency, the regulation dem.
And e easy. The first step na for go na the NPHA dem website wey na www.poi.npha.gov.sl or use your phone, tablet or computer for scan the QR code wey dem paste na the flyer dem na the side dem wey for enter all about the country. And even na the NPHA dem page na Facebook. The second step, create your account with valid email or phone number. Third step, ready your passport and medical paper dem. Step 4, complete your form and submit am. Step 5, get your digital confirmation and avoid delay na the airport.
Quick, secure and na by force. The Leone Health Travel Portal dey make you travel smooth and safe.
So register quick, travel smart and enjoy you stay na salon.
Sierra Leone Health Travel Portal, safe travel, healthy nation. For no more, call 117. Now the Ministry of Health and the NPHA bring this message to you.
Alright, Fambul, unakushe and Cabo again. Of course, today na the 28th of August inside the year 2026. And of course, as we know, today again a Friday, and every Friday 3 o'clock to 4 o'clock p.m. Salon time, we can always bring Master Sabi people them from the well body host them. We can talk to we about well body issue them in the country. Of course, for a very long time, we don't take a whole series for talk about antimicrobial resistance, and we do that on purpose because the data where we get the information, where we get, the research where people that they do, they tell we say, antimicrobial resistance, like how can always they say, now a global health threat now, and then of course we need concerted effort. We need urgent action. We need the collective responsibility and action of we all. So everybody need for first of all bridge the information gap, the knowledge gap. People then really need for be aware of antimicrobial resistance, know how it affects people them, and also like last week what we talk about, for look at the future. If we not combat antimicrobial resistance right now, what in the future will look like, especially in healthcare, in treatment, and about we well body generally. So they continue that conversation there on purpose for make sure say we bridge that information gap there. We make sure the people are able to take the appropriate action we the need for take so that we go tap the spread of antimicrobial resistance in our country. And like how we done the always the talk say it's not just about we the mutamandem, it's an aspect we cut across the animal sector, animal health sector. We last week we also get a conversation with the veterinary lab manager, Mr. Foresamba. We also explain, from the animal perspective how antimicrobial resistance actually they affect the animals. Then they, at some point, we don't also talk around the plants them as well, the environment as a whole, how also antimicrobial resistance, also the environment, they influence that as well. So now that conversation they still will come continue with, because we do it not just because we feel for talk about antimicrobial resistance, we do it not just because antimicrobial resistance now the only health challenge we salon they face, but because a need for we get more conversation around them because it don't become a very, very serious health threat. Of course, now the 60 minutes with health experts will come up from Population Services International Sierra Leone, PSI Sierra Leone for short, and then the program they come to you through the support of the EPIC project, where they implement with funds from the U.S. government through the U.S. Department of State. Of course, in the next 60 minutes, we also want for now specifically talk around, waiting some of the story them, because some of them things and the way they happen for plenty people we don't know, they don't build a lot of stories around them, but also behind that story, then they will look at what in science they say, what is the real data, where the labs, they tell we. Last week we look at the veterinary labs, based on the animals the way they don't sample. Mr. Fore LP, Samba able for LP for talk around, the pigs that we then don't sample, waiting the results say, the fall them we then sample, waiting the results say, and for tell you say 7 out of 10 of them pigs them they don't get some strains them way. If Motamanden consume them, it don't already begin they affect or develop what we call antimicrobial resistance, But also one for look at the human aspect as well, with the Motaman themselves, what they do do test them, now then laboratories them. The conversation therefore be very professional and more confidential. We know they call names and then identify people and records then, but it's about waiting statistically data they tell we from the laboratory perspective about antimicrobial resistance. We get a conversation around that, and from the community perspective, we also look at some of them stories, then some of them myths, them we still they promote the spread of antimicrobial resistance. And like I can say, antimicrobial resistance now not a situation where now like a crow where they come on you face where everybody they see, because if we only see the signs and symptoms them visible, like how we be they see last year with the mpox situation where the country been get, like we all for don't really they know. But because everybody not really they see, then it's visible signs then they, because it is internal, people are struggling, and people they blame the healthcare professionals, people they blame the health facilities, people they blame the medications, the drugs that they take for say they're ineffective and all of that, but they not really know which in the cause all of them problems and they so because of the data we they get from credible sources, we see say antimicrobial resistance now really a major health challenge. Now make we still they continue for drive the conversation around antimicrobial resistance na the country. Of course, today again I get two Master Sabi people we don't join me, and then they go for able for help we for talk more around the topic today. Before we start the program, fine one, I will go for make let them tell now the names them and introduce themselves to now before we go into the program. I will start with you, sir.
Fambo Lemona, good afternoon. Me na Edward Metzger. I then at the Health Promotion, Risk Communication, Community Engagement Department at the National Public Health Agency. Me na the AMR focal for RCC.
All right, plenty. Thank you, Meziga. Of course, Meziga not a new face, especially when it comes to antimicrobial resistance. As one I don't know, in the AMR focal, now the RCCE unit, now the National Public Health Agency, and so over time, you don't join with plenty time and don't share valuable insight around antimicrobial resistance on the country. But again, we get another guest today. We don't join with for the very first time. If you go introduce yourself, sir.
Family Lemona, good afternoon. Mina Arthur Gaba, Mina lab scientist from Ministry of Health.
All right, Mr. Gaba, plenty thank you. We don't join me for the very first time today on the program, and of course, we know say Mina Alicia Stamba Foyer, we moderate the program. So inside the first session of this program here, we go one for can start with Mr. Gaba. Mr. Gaba, you don't come out from lab scientist, and of course, now one party people, one party people where they sample, help for sample, motaman them, the test results them, or the samples them actually where they come na the lab. So far, waiting then sample or then result that they tell we, especially around resistance.
So basically, from what we don't see, which we don't get in the lab. Then the sources microorganisms in a way some antibiotic them they work with, not they work again. As a result of misuse, overuse of lentin, and people they take them like a candy or a chewing gum. Mm-hmm. So that will lead to what we discussed in AMR antimicrobial resistance.
So how prevalent, so how concerning then result then they for we as a country?
Well, it's very much concerning. If you take a look at what's happening at the medical space, whereas when somebody's sick, you begin to get some signs and symptoms, you go on to say, this is not malaria and typhoid. I can tell people and say there is nothing called malaria and typhoid. Malaria is an entity on its own, typhoid is an entity on its own, then it's caused by two different microorganisms. So taking antibiotic for treat malaria issue, that's an error. So instead of that antibiotic way, back then we used for take chloramphenicol when we get abdominal discomfort, but now it's no longer working, And then so over the counter people just walk into a pharmacy because they begin to feel one kind way say I want Kef, I want Cipro, I want malaria drug. Well, the Kef and Cipro, these are antibiotics being given for treat specific kind of microorganisms. So overuse of them a little bit lead to antibiotic resistance. So they need work again for kill or suppress that bacteria may not cause harm to the individual.
So like I mean, in terms of research or sample, like when I don't conduct any sort of research wherein with like out of 100 patients them or 200 patients the way they come in a month or 2 month period of time, when I able to do this look at the sample and see the one them actually we don't get the resistance against certain medications then.
Well, personally, may not do any research on that, but you get partners that we don't do research on that,
Okay.
and they don't bring credible data.
Okay.
Where, as you mentioned, say we're not going to disclose anything so far. We know.
Sure.
So, but couple of research are not be done. We don't look into the recent pattern of antibiotic now with space, and it don't ring a bell. Say we need to take caution with the way and manner in which we deal with antibiotics. If not that, there will come a time it go worse than the HIV and hepatitis we point fingers at. Yeah.
So that's really concerning, and that's why I mean over the last 3 months, 4 months or so, extensively, like how they say, almost week in, week out, we come at this space here and talk to people about antimicrobial resistance, and people somebody go to say, I mean, well, every week antimicrobial resistance, every week antimicrobial resistance, but you feel say, I mean, it's really something topical for they talk about frequently.
Yes, of course. That's something we for the talk about every now and then. I don't think in a certain way, people they frown at somebody with positive of HIV. I can always like for bring HIV as a scenario.
Yeah.
But I think say another thing you will be for the frown at now the way and manner in which we use antibiotics as I mentioned earlier on. Like as I say, small baby self way make say Mark I go take Cipro. You get. So there are another one just beat the gun. But make her just try for the lady premise. So there is this thing where, scientifically we call it methicillin resistance staphylococcus. So of course, then get the microorganism we get in your way. Staphylococcus now microorganism will get in your way of handling human being. It will lead to osteomyelitis, cause issues with the bone. But if we don't misuse, antibiotic, we for deal with staphylococcus. At the end of the day, we're not able for control staphylococcus when somebody gets infected with staphylococcus. Okay, simply now the salmonella typhi when they cause typhoid fever. We don't misuse, overuse, antibiotic. Anybody can just walk into the pharmacy and get any antibiotic. There will come a time where antibiotic like KEDA. When rebel will come, of course the country they look at the rebel they come inside. So let's look at the rebel they come inside. So the more than they put reinforcement for preventing rebel may not enter. You understand? So now the same way how antibiotic they work. So now by level, if you don't take level 1, you suppose work for deal with level 1 microorganism, take level 2. But now what's happen because of the misuse and abuse of antibiotic, they move from level 1 go level 5. So the antibiotic for deal with that specific bacteria at level 3, you don't jump. So you're not even able to deal with 1, 2, 3, and 4. Now you don't go 5. So you get more resistance pattern from 1 to 4. You understand? And it prevailing and it alarming. As a nation, ideal at all.
Wow.
Yeah.
So what are some of the common drugs them we don't see? I mean, commonly based on trend over 2 years, 3 years, the pattern as you don't explain. Which one are some of the most common antibiotics that we as a country we don't really misuse?
One now when I kept ceftriaxone, and another one again is ciprofloxacin. And another one again, when I kept of course ceftriaxone and another one again when you go now and some facility or some clinic or one when I kept ceftriaxone business and another one if they now go now those the individual some facility or some clinic we don't take like when I kept ceftriaxone business and another if they now go now those the individual some facility or some clinic we don't take like when I kept ceftriaxone so when people go if they now those the individual some facility or clinic we don't take like when I kept ceftriaxone so when
like every other time, like every other
level 6, level 7, level 8 as an example for fetal level 5 tumor. You get? We now match for match. You know, for do lower and higher. Now match for match. You get? Yeah.
Yeah, I mean it's really I mean a very big problem. We Salone, I think we really need for take more action on, like how we don't always hear it from every time we get different guests, then really they reveal to we some very hard fact and hard truth about antimicrobial resistance. And I make we put a lot of resources, a lot of time into talking about antimicrobial resistance. Not that there are no other issues for talk about within well body issue, but because I mean the revelations we get every now and then about antimicrobial resistance, then really alarming, and we don't talk about them over and again, that they self-medication then we can do, you know, just walk into a nearby pharmacy, go buy medicine for yourself, you know, just feel you that, just feel small cold, no more, you say, I get cold, I go buy this, I go buy that one day, you know, then really they cause a lot of problems. And that's why we spend a lot of time and resources they talk about these things, so that I mean tomorrow Bambai, the entire country no go just wake up that we get certain common sickness, then we mercy not there for them at all, not, you know, mercy not good for treats them, you know. And that's the situation we, I mean, a lot of people probably don't reach that kind of level there, and then go begin to say that doctor they now not good, you know, sabi in work, you know, that hospital safe now, they not to better hospital, I don't go the past 5 term with this same sickness here and the same problem no more, you know, begin to say I don't go one hospital, that hospital, I don't go different hospital with this same sickness here, or sometimes they just feel a little better than discharge you, you know, you're gonna host after 2 weeks again, the same sickness come up again. You know, we're gonna hospital sideway for take 2 days until they get for admit you for like 5 days or even more time. You know, a lot of people they go through this for a very long time. You know, not like a new thing. You know, a lot of people are going through this practically on a daily basis. You go into hospitals, you see people who don't take 1 month, 2 months, or even more. Now, sick bed. You know, because probably the medications they give them, like effective again. You know, they work. You know, so I mean, we all really need for take action, but probably Lord can hear it from Mr. Meziga, you know, because for a lot of people when they talk about antibiotic resistance, they go just be say, this now one big word, scientific word, or that this now for medical doctor them, you know. I mean, in common terms, one for let you paint a scenario for let people them really understand what in an antibiotic resistance or what in a drug resistance, where people then go really able for understand in common terms.
All right, thank you very much, Mr. Moderator. First, we go start with somebody gets wound. When I go say a wound infection, but you dey take antibiotic for cure am. Then 2-3 days the person stop. He feel say he don't feel better. Then you the cow, my brother be the say just now. You dey give the bacteria opportunity for survive, because you dey make that gap where you dey get am, where you dey take wrong treatment for that particular thing there. Then also e dey make you become more resistant. Then later that same infection dey you want for treat am with that same kind drug dey, e dey make the treatment become longer, and at some point sef the medicine no dey work again. You don see. Then another one, like for example, you dey take prescriptions wey dem no prescribe for you na hospital. You just grab, you go over the counter and buy for yourself. So survey don show say patients dey actually dey buy antibiotics wey dem no even tell dem say na this you for take for cure this. Then after some time, short period no more, then thing e begin get changes, then later e dey adapt and dey bring up some resistance. So in a short, antibiotics actually you dey try for make the wey you dey misuse am, you dey try for take the medicine for cure yourself, whilst you dey take the wrong one for the wrong treatment. So you no go sick cool, then you dey use treatment wey na for virus, for bacteria, e no dey go. Yeah, so na the misuse than the who dey talk about. Then leftover drugs dem. Yeah, because Adam say be don sick, he take this medicine, because you sef get that same signs dey. He say, well, hey, Adam say whether medicine Adam say pass the balance give you, you sef take am. Then dey e come on a community where people and dey practice every day. So we happy we dey get opportunity for the talk this over and over and over, for make people and they understand this.
Yeah. All right. Plenty. Thank you, Medziga. Mr. Atto, let's come again. I mean, without breach patient confidentiality at all, not you able for share probably a story of a certain patient where maybe he can't do first test, then put on first treatment, and then maybe along the line, based on the results or maybe based on the way the treatment be the go, una end up for change, then therefore end up for change the treatment as a result of drug resistance.
Yes, that like I was not like a syndrome now, like something like ongoing thing with happen in various facilities. So it goes so appalling that so basically typhoid. I'll give an example. When somebody then clinically based on waiting present, we say we suspect typhoid fever. So sample will be collected, check the sample, go and carry out the analysis. So how will they come about first for no say this drug resistance?
Yeah.
Then antibiotic care where people they drink, so they disc them there at the various labs there wouldn't they use. So I wish if I don't get that way for make you see exactly, but I believe say you could be opportune one day for go and go spitting the happen. You go see the fascinating side of
yeah.
So the disc them, let's say if now you get ranges and brands. So let's say if now 7 different antibiotic, then they in 7 different disc. So call them disc. So after we don't collect the sample, the process kind of long small. Then they put them in a Petri dish. We call them Petri dish. Then when they put the sample, they put the disc them for see. Put the disc them na the Petri dish for see how the suspected bacteria they react towards the antibiotic. So there has been a case wherein out of 7 antibiotics they put for this individual, for example, now only 1 sensitive, all the balance 6 resistant. Yeah. So in that situation, it not be even warrant for it being so worrisome because you will begin thinking now what's next. What's the next set of drug we for go? As I mentioned earlier on, it lead for make you, instead of you use the baseline treatment, you move from baseline to middle line or upper line. You understand? So situation like that don't happen. Then again, of course, we don't see wound swab where as a result of the person don't misuse antibiotic, same thing again. Then go further and look at certain the drug panels them when they do the test. Of course, we call an AST. After the AST, realize 9 out of 9, only 5 they work. And then not only 4 they work. The 5 when are baseline we supposed for use on a daily basis, we supposed for work, not they work again. So instead of the wound for heal up, it extend now and become cancerous. You get. So now some of the instances of that. And commonly, as me what I mentioned, people they misuse antibiotic, more take out the testing side of it. Common cold. You know, for me I believe in treating common cold symptomatically. How you feel signs, how you feel the body, you treat them. If you notice the block, say take Boku fluid, take vitamin C and rest. But people can just jump, go get, in fact, na combo they do. Amoxicillin and erythromycin. Say this column, it don't want me. You know, cold and they do me. So the cause of you taking amoxicillin and erythromycin, you know they know the individual they know what's happening to them. So you make your system become prone, you know, to whatever get for invade the system. And the drug that we don't use, there will come a time where the drug they work again. You know, so like now 3 instances I give you now. The area of typhoid, the area of the wound, and physically now waiting with the feel as an individual. Or those you jump go na any pharmacy or drug you know outlets and then buy. And another sad thing again, we of course also have that discussion with somebody. I mean, environment, of course, don't you ask me that. I mean, we get people who are drug peddlers, so they move around. They don't know the efficacy of the drug. They don't know the pharmacological effect of the drug, and even storage. You know, they put them on any side. So even if that antibiotic self for work, you're not gonna work because you know the appropriate temperature, storage not okay, and the likes.
These are all issues we don't talk about on the program yet. Over time for talk about, you know, then drug peddlers then, because like how you say, the temperature level drugs will be stored at a certain temperature level. You know, then people and they can just take them drugs and they put them inside pillar. Or put them inside blind, you know, put them inside whatever thing, you know, whatever rubber, then they call themselves well body, you know, then they quarry them, then they boss pack them, you know, then they the slum communities, then they boat them, they ferry them, you know, they are everywhere. You know, we don't, at some point, we don't talk to, the pharmacy board, you know, we don't talk to, I think, the pharmaceutical, something units the ministry. So we don't talk to different people you know, set of people way for really take responsibility for address issues around antimicrobial resistance, especially drug peddling, because at some point medical been there again, we'll talk about this drug peddling as one major driver, the accessibility, you know, because it is accessible, sometimes it is very cheap, you know, and you know, so you left sit down at a garage, for example, or you go to Motokana garage, then somebody can, maybe you are tempted for let you buy, because in one grade, one medicine, one tablet, you go say the man 100 sick, you know, and all of those things. So it's really serious and it's alarming. Like we don't tell we so for say like in the aspect of the wound, somebody don't wound, you know, they don't sample, they don't put, like I explained in scientific terms, the different antibiotics then probably out of 9 are only 4 or 5 no more go likely work, or maybe to some point, none of them are really able to react, none of them know they work. You know, for them kind of people and they, like, what in their condition, you know, how do they end? Where like somebody they were in all the different antibiotics, there were different medicine they were for men am from that particular sickness they don't misuse them, all the drugs they resist them now, or the body they resist them drugs them they now. What in that mean for them can people them they?
So I can like first, lay down premise. You mentioned say well, body agency don't look at say make we stop drug peddling and all. But AMR now everybody's thing. It's not a one man show.
Sure.
You understand? You the consumer, you the producer, you the one who they do the business. It's everybody's thing.
Yeah.
That man who they sell, what you want, that money want.
Sure.
You get.
Yeah.
And you already drink, you for no say. Nothing we not be know. The sensitization not be known day out there.
Yeah.
But now people they talk say nobody medicine meet yambal we put on a bucket the waka. Nobody medicine from Pafode we put on a blind the waka sandon bonam. You get. So first of all, nothing we all need for take into consideration. It's like as I mentioned, it's like we rebel in the try for invade you talk. You must get people with the sea where stranger they come inside. Not so. Now the same way like we not say waiting they happen around we not make sense. It's not correct. But we continuously do accessibility and cheap thing now this world I know say now like we use shortcuts. And shortcuts in life but it personally end up well. If I for make we they go the right way. So on a regular make it tell people and say before you see them say sick tranga sick all you but say that money way we they use do fancy food thing make we go hospital and they will treat her. Now back to the question we say but somebody we all the panels and don't become resistance. In medicine we get acute and chronic phase disease condition. So during the course of the antibiotic maybe the person the manager now acute phase that. Then prolongation, the more the sick is in the person body, they become chronic. So if the antibiotic not they work, then the condition they become chronic. Vis-a-vis, the person going up die, going up lost in life. Because you not get nothing with the help for fetal for make it survive. Nothing not the way they microorganism then they one side for live. They are dwellers, just like how me and you they who within this earth, who they can't walk not so. So man they go soul any kind of way just for make you survive. Now so then thing in now tumbu they want for survive. And now wait till we get inside with body, then they dwell on, and then they live by. So the more you they give them environment for me they survive, of course they go survive. And when they survive, then if now two being come inside, it they multiply. It they become 50, become 100, become 1,000,000. And your body, the individual body they able for fetam all on your own. And if the medicine for them gives it for fetam, no they will for fetam, then there comes in the issue. The person will eventually die. So now the situation that.
Yeah, so I mean that's the end point. Definitely, no matter how you look at time, you go with tango and to say that's the end point. Because the medicine if we're able for cure, if we're able for men or for kill that tumbu the way they cause the sickness na your body, but if the medicine not there for kill the tumbu na your body, then the tumbu get for take over the body, and when it take over the body, definitely. I mean, like my brother said, probably, I mean, at some of them point, then they had to stop that one day, but that's the reality about life, That's the reality. So today, I mean, we tell people them like every day, as they say, stop for self-medicate yourself. Stop for the pepper doctor yourself. Stop for pepper doctor yourself. Like we, Ato don't just say, I mean, the best thing you can do, I mean, instead of you begin to buy a fancy phone for yourself or whatever, treat that sickness the way you get, the right way. Go to hospital. First of all, last week we don't talk about diagnosis, laboratory diagnosis. For say, make sure say before you start any treatment, now for do test first. Where the doctor don't tell you say go do this test here. Let them alright test them for you. This hospital anytime we can test no more, go do this test, me I don't get money for this. Me I no say just go buy Cipro no more, I don't drink I don't well. That lab test the way they balance, it gets a negative impact on you well body one. And like we see the end result of na death, So let we stop that. So Mr. Meziga, we don't get from the science part of it, the data, the scenarios, the different points that we don't get from the scientific point of view, but also at community level. I mean, you from the communication experts, from the risk communication and community engagement unit na the National Public Health Agency. You dey relate with people na the community, and also in your capacity as the AMR focal RCCE, you go don come in contact with story dem, real life story dem, where somebody don share about how e don go from one hospital to another, you know, get treatment, they don do all kind thing, you know, get treatment. You know how some of them story then they maybe one or two we go able tell we from them we go complement then laboratory data then what they analyze or what they talk about.
Yeah, I believe say inside this country no community no the way person no don't go through wetin we dey talk so. That na the honest fact. Because for example, if I can remember inside in 2019 we be dey do one engagement, I think na Koinadugu district, where person be dey share im experience about where they pass with am from one hospital to another. So imagine that person didn't get the opportunity for talk to we. But cool people and they will not get that chance. Then go they wonder wetin make I dey pass from one hospital to the other. This thing not the well. You don't see. So this one-on-one interface with the community people, it dey help back for let them get their understanding there, because AMR business now all man business, and the issues them it dey na all community. Yeah. And for other example I go get again, the animal them back can forget for talk about them small, where they can give them medicine, where they feel safe for give them normal at any time. Where for example for chicken, you give chicken say for make it go fast, then we just grab, we go get access to that particular chicken day, we eat and it transfer back to we the mortal man there. So some of them after thing and they make the AMR business it's rang up in the country. You don't see, because now all man business. So the scenarios them it cuts across all communities them, because now daily practice. And I can tell you with my interaction with the community people that they do them unknowingly. The awareness not be done. I make for now where the knowledge done the special program they don't the way don't develop messages them for guide community people. I think now continuous awareness raising now go help for let we win this fight.
Yeah.
Like yesterday, so we begin with the stewardship where the 16 district, the MS them, the matrons them, some pharmacies them, we all be there in a gathering. Then self they make them commitments on waiting for do for make them tap AMR at facility level. You don't see.
Yeah.
And the commitment there, to be very honest, it was really exciting, because when myself they after I don't note all thing done, I feel say yes, we they work on the right path for let we really put stop to this. So the community themselves get their own goal for play.
Yeah.
With them practices and the way that they do. Some can do it unknowingly, some can do it because they don't get the knowledge, but because of it, I no more say, well, I don't but this one no go and bug me.
Yeah.
But you know say you they affect yourself. So me I go say currently we sit on a time bomb by this particular issue.
Yeah.
We dey now on top time bomb now. Yeah. So we all need a multi-sectorial approach.
Sure.
For how fit this particular
I totally agree with you. And then of course we serve as an organization, we be don't define out here. I mean one part of the issue they contribute to the rapid spread of AMR in the country. Now the knowledge gap, you know, and so now I make like over time we don't dedicate a lot of episodes them, you know, in this series here with the air every Friday. You find out say then they more around antimicrobial resistance, because one for make sure the people them get the information, and I mean let's say information is very powerful, and so that's why we dedicate, I mean bring different stakeholders them, different people them where they talk to you, and every week where people them come then really they talk to we, you know, from that expert lens and give you the right information actually where we need for understand about the prevalence, the health threat, and even looking at the future of we well body one at the country, if we not address issues around antimicrobial resistance. But Mr. Gaba, somebody go on for no, boy, me this thing also I don't do, so probably I need for begin to go do check them. Is it like any mechanism they voluntarily where myself can just wake up no more maybe Monday, I go to hospital, say do I want to sample me system with the antibiotics them, or except somebody sick before ever, how does whole process that they happen for Leone to the sampling them?
Yeah, so for the person for sick first.
Okay.
The person body forget something for make you go hospital.
Okay.
And then do sampling. Then go tell say this person, well, this bacteria no they work with this medicine, or this medicine work with this bacteria. I can say in Africa, we not get healthy human being at this this part of the world. We all they manage. But you get the one that way they above average. So it's about healthy living, and so you go protect yourself, and even the environment. I can say woman them, then they in the habit say when they don't see their menses, then go take antibiotic, say for flush. Again, that's not a good practice that. So then kind of if you don't continuously take antibiotic
every month,
you not go walk
because every month you get for go through your menstrual cycle. So every month you get for take antibiotics them wrongly.
Exactly. And then can even if there was a way for make you say healthy person can walk into the health into the facility and say I can do check. Of course you must see resistance pattern of the individual. People who are sexually active say, I don't do my man and the business, I go take antibiotic for flush my system. There are specific drugs and way you go take, where them prescribe. There's this one at doxypep, doxycycline, they use as post-exposure prophylaxis. Wait for you be using within 72 hours or so. Then you understandable. But normal person don't go do some kind of game. Say I go take ampiclox, ampicillin, load yourself, say for flush myself. That's not the way. So, in our ideal for make you just walk into the lab, say, I can do and XYZ as the case may be,
So you get for sick, and then that particular sickness, the way they don't diagnose you of, now then get for bring the different medications, the way possibly go mend that particular sickness.
Exactly.
Okay, so that's the process. So you see, so this is what makes it even more complicated. Because not to something say way like you go say, okay, let's say HIV, like I've been talking about. Somebody can just say, let go do test. Let just know my status,
Yeah, but even with the HIV, every person begin feel one kind funny way. They make you go hospital.
Yeah, so man can do that. They just know my status.
Yes, normally.
Yeah.
It's good for make we know we status. But unlike this one,
Yeah.
except otherwise, but unlike
That's
this one,
the case. That's the situation. So now make we, fumble them, as one of the listen. This is the reason we every other time we really talk about this antimicrobial resistance, because not the visible signs, get visible signs, you not get something where you begin to see all over your body, or other person they see begin to notice, hey, boy, what's in the na you ate so, what's in your back so, and not to something where voluntarily you can just step into a laboratory like how Mr. Gaba don't tell you and say, people they talk about antimicrobial resistance. When I sample my body, my system, let I know if I don't begin to develop, my body don't begin to develop certain resistance on against certain drugs them, So you get for sick, and when you sick, you get for go to hospital. When you in a hospital, then get for diagnose you, then see the sickness where you get. Then that sickness is now where you get now at the lab level now. Then we begin to look at now the different medications. Then we possibly go mend that particular sick day. Then they say, okay, this one here, this they work. Okay, this other one not they work. Okay, this other one not they work. This nine they work. And all of that. So you see, so if you don't decide, you don't sick, then you decide say no, me not they go to hospital at all. Not. You see how difficult they make the situation now. Because they're not able for sample you body against that particular sickness there versus the medications them for really know which right medication way for able for take. So you go just the pepper doctor yourself no more. So that makes it very much complicated. And the data really they tell you say there are a lot of resistance issues in the country. and I make every other time we dedicate with time, with effort them, with resources them, but talk to people them, so now it's no longer about knowledge gap, it's now about you action, what do you need for do, and a day I will bring in Meziga for tell me, waiting the people them, moving forward. I know say plenty time, almost every time we can at the program, we always they ask you this question here, about waiting the people them really for take as an action, for let we all tap antimicrobial resistance in the country.
Yeah, first of all, then for understand this message what we dey tell them and not keep am to themselves. Learn for make other person understand what you yourself don't understand so today. Then the most important one, make sure say you not go buy medicine because you feel say na that medicine dey na ain't good for you. Buy medicine wey dem prescribe, say this medicine na ain't go cure you, so go look for this medicine. That na one. The second one, no dey use leftover medicine. If you na 3 or 4 day na house or na the compound, then they be don sick malaria, you back and sick malaria, you ask her, hey, where you be sick malaria, then you medicine no you be buy, you be done all, he say no, I think na 2 days normal be take, I feel better, now I left. So yeah, the balance, you self take am. Na thing the way they happen at community, but then that wrong practice. So they encourage people let them know they learn for take leftover medicine. And if you know they take leftover medicine, same way so no learn for share medicine. It's simple. Oh. I know they take leftover medicine. So maybe I not forgive person.
Yeah.
Then he go take me own leftover medicine. So now some of them think that we want let them know because they no buy medicine to person at treat because in they do advert.
Yeah.
For sell, let keep in your day running. Then you they endanger yourself or they put yourself at risk. Some people know, some no know. But you will get opportunity for listening to this program. Know this now say na bad practice than the way people they do every day. So be that ambassador for help spread this message. Say, Salon, this bad habit will get to, but not to him now for they do. La no dey share medicine, la no dey drink leftover medicine, la no dey go buy medicine because I feel say na him for cure me, meaning I no for go buy medicine wey dem no prescribe give me. Then same way so like I dey do the things the way they advise me for do, meaning for complete me medicine in those them. Then another very important one. Then go say well take this na 20 medicine for take two na morning, 2 na night for take am for this period yeah. But because of you don't feel better no more inside 2-3 days, you don't jump back. Then they call me and I be say well I go there. Then they forget and the medicine back they then say take this 8 o'clock na morning, 8 o'clock evening time. Now the time difference than they want let the medicine they work.
Yeah.
So not the way you feel. Say time don't pass, but count a drink.
Man, take this one.
Yes.
Yeah.
All them practice and they would sound like it common, but now them drivers and they don't make they like it today. We sit up at this time bomb. So do ya now we all hand for can together, backlog we come out on top this time bomb. Over to you, sir.
All right, plenty thank you, Mr. Meziga. Mr. Gaba, of course, una dey at the lab, una they see more waiting they happen from inside, using that perspective there, or using that lens there. Waiting you go want for tell we fambu them, we they listen to we or we they watch we today, for make them a habit, especially for make sure say before you start any treatment where you seek. Now for first of all do laboratory test. We go tell you what's wrong with your body. Yeah.
So, Salomon, because I know say the nationwide talk with the do so.
Sure. Exactly.
We for be health conscious. We be health conscious. You they prevent yourself from all the two they talk so making happen to you. Salomon, we like for bluff. As we mentioned earlier on, we don't mind for all sophisticated phone, drive big car. Dress well, put on the best and nicest perfume. Every weekend then I treat the ladida. We don't mind for do that. But when it comes to getting quality health care services, it get ifs and buts. So that don't make us we don't repeatedly overemphasize where they lead to this. We dey on ticking time bomb, we dey on working time bomb, all set of bombs we dey on right now. Land miles, all kind we dey on right now because of we habit. If I can remember, I don't know which one of the presidents will say attitudinal and behavioral change. So we need for change with attitude, with behavior towards the use and abuse of antibiotic. Now, if you sick, the first point way for go, not go to a pharmacy, say make that pharmacist go treat you. Not go and go begin to dictate terms and conditions to that pharmacist. Or not go to that hospital, say, me I can for or go to any hospital, say I can for this medication, I can for this medication. As regardless, then when they sell drugs and treat, now then put powder, then infection nonsense. In pharmacy, then get waiting and call pharmacodynamics and pharmacokinetics and the other one I don't forget a little bit. So it show the drug I for take them determine for 1 4. Then when they already sell and then boss then then whatever. They don't get no idea as to how the medication they work. So if you the individual they continuously engage in any kind of stuff then you do yourself more harm than good.
Yeah.
So it's better when you sick, you go to hospital. You get there have been existing hospital and then Arab clinic that we then get routine where you go to the same day after them pack you. Of course, we dey well mentally well, but the business get for do with person well mental being. If you know say I go take this out well, you do well. Preliminarily, well surface, but the sick is still inside.
Yeah.
So if that's a person sick, you go hospital. Even if not signs and symptoms, so you don't feel with say this not they do me regularly, go hospital. Not take chance, make her go na this pharmacy or make her go meet Antikadi. Antikadi na the best nurse. They go give me this medication, they go give me IV, go give me this. You know, what I know they do, I need to tell other people there for do. Me afraid sick bad as a medical professional. Afraid sick attack because I know the implication why I go take wrong drug. I know the implication why I not go hospital. You know, I know the implication why student also not get diagnostic testing results. So it's better you go hospital. You will for be curious, say, doc, I can, you know, make tests for me. That's for me with curiosity. You not for say, doc, you just prescribe for me no more. We're not for glad you say, doc, I can, you cannot, you just give me medicine, no more, I go. No. It do tests for me, then I see what thing that bug me, you find. That's why you know say the medication you take now the right medication.
Yeah.
We're not for live in a blind world.
Sure.
We need for utilize social media well. We go guide with to say we are sick. First point of call now for go to hospital, see clinician, get tested, get the test result, put me on medication, and then I move on life.
Okay.
Yeah.
All right. That's a very brilliant one. But then maybe out of curiosity, Abuanfo asks this question: is it for every case when they do then sampling? Then, like for example, today I don't go to a hospital, they don't diagnose me of a certain sickness. You know, is it like every case? Now, when it comes to lab, now when they look at this particular sickness here, and then when I look at all the possible drugs then way for possibly mend that particular sickness, there, or not only in certain situations or scenarios when I can do that.
So it all depends on waiting the clinician in request for. So the clinician requests for culture and sensitivity. Sensitivity now for look at they do the culture, isolate the microorganism which affects the person based on the sample you go with, and then after the isolation then subjects that microorganism to antibiotic. We have the sensitivity. So by virtue of clinical practices, when patients sick, they're supposed for in an ideal situation that kind of thing is suspect you do culture and sensitivity for the person. So you go culture the sample, see if there's any growth of any suspected microorganism, and after which then subject her now to antibiotic.
So usually it can happen like for every case.
Yeah, case specific.
Knocking off
You know, case specific. You know, go do culture and sensitivity for malaria.
Yeah. For like sickness, then we wanna know. So okay, this you get for do with antibiotics.
Yes, like typhoid. You know, really caused by salmonella. So of course you collect you stool, you do you know, they get different media.
What I want to know is it like a normal practice within the hospital setting for say anybody will come with any sickness we probably then get for administer antibiotics.
AST thing for do.
Yeah.
You know, not like normal practice. We are things in a thing where, as I mentioned, ideally that's what's supposed to be done, and that's what we're supposed to do. So, as consumers, as in the one the way they take the medication, as we practitioners who self need for be health alert, health conscious way, when this person come and not for just do surface diagnostic approach, for do in-depth diagnostic approach. You know, where we now like as we say a collective effort. We go talk if we were the meet in the hospital, no they do no problem. If the only way where they coming to back from the hospital back, no they adhere, no problem. You get so now like you do to what a dog's back. So by that you supposed for be cut across it. Once na suspected case of any microorganism, you see go post straight on that person, make you do culture and sensitivity testing and know which one are the ideal antibiotic for the person.
So as a country, how many laboratories them or labs then we will get where they do AST?
I not get on top of me, Eric, but you get key facilities and where they do them.
Okay.
Like Connaught Hospital, they do them.
Okay.
Oladugu Children's Hospital, they do them.
Okay.
Then another one again, McKinney Regional Government Hospital, self they do them.
Okay.
You know, so of course then they on top of situation with regards to that. And now the country for me, clinical practice is not Connaught na the referral hospital. For that, you will get then you will get other facilities and we they do another labs that we do like to name but few Ecomed, not advertisements that they do for them. Ramsey, you know, Premium. These are facilities where they do AST, you know, culture and sensitivity for people who then suspect of being infected with any kind bacteria or microorganism.
So if for example if I go to hospital then diagnose me of any sickness we get to do with bacteria or any microorganism or then put me on a particular treatment we get to do with antibiotics and then say maybe let's say a typhoid the common one, right? I can able for request a doctor say when I don't do cultural and sensitivity test on me for really know which particular antibiotics more effective on me now.
But you see we as practitioners, we are not gods. Far from it. And one thing at me learn, you know, from a little experience where I get out of this space, out of salon, that patients get right. Your body not right. Nobody go take needle and go dock on your body where you don't want. If you don't want, even if you die, you don't want and say I don't want. We need for adhere to that. So if me go hospital, you know, and then as he say, because well not everybody knowledgeable, as he say they not do this for me, I go ask, say why will not do this for me? This is my own personal experience. I don't know if we get time now, Jan.
No.
When I've been sick, I go admit. So the nurse just come because now till in the afraid for tell people them. So I see in the move from bed to bed, not knowing say I mean a medical practitioner, I mean a health provider. So you come up bed 1, then do cage, you go bed 2, then do cage. It come to me now, I see pull one small cassette. And I was like, what you one can do? So one can do HIV test. So now I can say, how you want for do am? You take me consent or you just do a number for make you get that data. But now I just been some intern and I feel when they don't do the test and then they do counseling. So I was like, you don't get an idea as to waiting for do because I feel say this is a sensitive case. My body na me right. If I want for do I do it. If I not for do I do it. And I do me test regularly. You get so I know my status. Now if me go say I want know my status now you go, but you know they can't force me into doing something I don't want for do. So when I go hospital, I go tell you say I want this thing.
Exactly.
You know, if you do this preliminary for me, I'm not satisfied. I ask you say no. You know, and now cultural thing we need for accept. Say patient get right, me and patient need forget conversation. I not go for go turn patient like me picking. If you say no one time, you get. So
all right. Plenty thank you, Mr. Gaba. We not get enough time again on the program. Tend on between bad one. But as we conclude, Mr. Meziga, as we step out of this program today, people they listen to we on the radio line, people they watch we on YouTube, on Facebook, and different other platforms. Then within that strong message they we want for left with we people them as always as we can do as normal behaviors then with them for the practice, especially about the well body one, for that we all combat this antimicrobial resistance I would always talk about.
I no go tire for talk this, and I go always dey say that small habit wey we dey do na we host in a community level wey we be don feel say na the best, do your leg we tap am. Wetin are the habits there are? 1, for the share medicine. 2, for the take them leftover medicine there for continue with treatment. 3, for the treat yourself, the drink medicine there halfway where you feel better, you stop, where you know the complete you dose. Then the final one, for the go buy medicine where they not prescribe give you from a qualified health practitioner. Like how my brother they say, Arthur, make sure say you know wetin they treat you for, meaning you for the go na hospital, then do test by you, let you go able know wetin actually do you, so you go know wetin for whose medicine go cure that particular issue the way they monitor you. Una thank you and tata.
All right, Mr. Gaba, what's in that strong word of advice where you want for left with people them where they watch we or they listen to we, you know, what's in their young role and responsibility for take care of the young well body one, you know, make sure say we combat antimicrobial resistance together.
Yes, I want to say thank you to Una for this opportunity Una give for me to come shed more light on them. Me, what I go say to people who they listen, we for be health conscious. I feel so when you be health conscious, you able for tell your pikin, tell your brother, tell your sister, tell your husband. Even when you go hospital, you go tell the practitioner where they see you. You could just be health conscious and no say we not for buy medicine a treat. So drug peddler, we not for buy medicine a treat to post where they sell a boss. We forget prescription from hospital, take and go to pharmacy and get drugs. If we change that business day, we go minimize the risk of the time bomb they work under up and tap when AMI.
All right. Okay, we will continue for ask questions. We will continue the conversation with different guests them every other week. You know, we will make sure say we bridge the knowledge gap. And we trust, because me personally can go through the Facebook comments them in my quiet time. I really didn't know like the feedback we would get from the people them around, especially around antimicrobial resistance. Every other week when they talk about antimicrobial resistance, people can really respond. I mean, in their own quiet time on with social media platforms, then we can engage with the contents them. We really appreciate one, and we will continue that conversation day. But let we not just talk about time, you know. Just the talking, now we always take action. When we can comment, we can see them beautiful comments then they about what different people and different stakeholders them for do, you know. But as much as we tell the stakeholders them for take them different actions, then they want to self do help spread the message to other people them around you, you know, in your quiet session, you know, whether at the attire base, wherever you find yourself, you know, talk to people them, especially you left sit on an attire base, you see that well body woman they come with that blind, begin they sell medicine to people them, you know, or you dinner boss, you see them people and they way they sell one tablet the man 100 sick, talk to people them, you know, the one way they close that to you, we want for buy, tell them say this person not get any idea, you not get any knowledge about how this medicine they work na your body. Go na hospital, let them do test. If you get any sickness, then go prescribe for you and you go get the right medication where you do. Of course, me na Aloysius Tambafoyo. And of course, we want to tell Population Services International plenty thank you through the EPIC project. And of course, we don't know where they make this program. They come to you every week. The U.S. Department of State. We want to tell you plenty. One ourselves we can engage with the content. We can watch we live. Now we continue the conversation and continue for make sure say everybody do the right thing what we need for do. Until we meet next week again. In Aloysius Tambafoyo. Bye bye. Take care and tata.
Salon, now we continue. Sweet salon, now we for try for build this country. Bye salon.
Travel smart, dey safe. Salon they welcome you.
You dey plan for travel from